If you had to sum up the 3 key barriers to access to radiation therapy, what are the 3 key barriers for Maori people?
One will be that our system here is publicly funded, and so we have 6 cancer centres across New Zealand, but these are located in our main cities. So for people to access cancer services like radiation therapy, they have to travel to these big centres. And so if you come from a position of deprivation and you can't afford the cost of travelling to these centres, the cost of accommodation, being away from your whānau or your family while you're undergoing treatment for a length of time, all of these things contribute to access barriers for Māori. So in New Zealand, we often talk about it as a postcode lottery, meaning if you've got a postcode that sits within a big centre, where a cancer centre, then your ability to access those services is much better than those that are outside of that. So my role is also around working with social services to ensure that, to mitigate the risk of an access barrier, that we assess those things early for our Māori patients to be able to come and access funding and all of the support services that are required to get a patient into the service and through to the other side with a good experience.
And that funding is assistance for travel, assistance for accommodation?
Yeah, so it's currently under review in New Zealand, but it's a national travel assistance called NTA, which is a national government policy. But there's variability around how you can access that, depending on where you live, your age, but also your income level. So, and often you can't access that either. So that it creates more, there's more risk there. So having a real good depth of understanding of those things in my role is vitally important.
What would be the other 2 key barriers, if you had to name them, that mean Maori aren't getting sufficient access to radiation therapy?
I think there's individual factors that impact access, and that will be people's prior health experiences impact, whether they'll come forward. They might have had a whānau member or family member that's, had a bad experience that, and that actually impacts your decision-making. I think also around, the cultural safety of our services as well is huge. So how we as a workforce, we need more Māori health professionals in our workforce to care for Māori. So kaupapa Māori services by Māori for Māori can be enabled by increasing our Māori workforce, both in hospitals and in the community.
And there's that expression co-design that I've heard you talk about. A lot of people don't know what co-design is or cultural safety. Are you able to paint me a picture of an existing service where you think some co-design was involved and it has led to greater cultural safety, so we can understand what that means?
Sure. So, for example, there's been co-designing a co-design in cervical cancer screening for Māori. So Māori in cancer screening have, come up with their own advertising that really targets and promotes cervical screening to women, using Māori language, using Māori imagery, with Māori health professionals. And so, that really impacts accessing services in terms of making them culturally appropriate, and that it's that there's a level of comfort there when you see Māori, you hear Māori, and it promotes health from a Māori worldview.
Wherever we live, we deserve the best possible chance to survive cancer and get the treatment that we need.
Aboriginal people should be able to access radiation therapy if they need it.
Right now, there are Aboriginal and Torres Strait Islander cancer patients who are struggling to get the radiation therapy that they need.
In some parts of the world, it's impossible for most cancer patients to get radiation therapy.
Māori should be able to get access to radiation therapy if we need it.
The Targeting Cancer campaign is supporting the work to close the care gap in radiation therapy at home and abroad.
To learn more and to find out how you can help, please visit the Targeting Cancer website.